Hello, I'm talking about sodium zirconium cyclosilicate for urgent therapy of severe hyperkalemia. Definition: severe hyperkalemia can cause lethal cardiac arrhythmias and represent a medical emergency. Exciting therapies do not remove excess potassium, have uncertain short-term efficacy and poor safety profiles, or are invasive and costly.
What is the role of potassium in the body? About 98% of the body's potassium is found inside cells, with the remainder in the extracellular fluid including the blood. This concentration gradient is maintained principally by the sodium-potassium pump. Potassium is essential for many body functions, including muscle and nerve activity. And it is excreted through the kidneys, so if something wrong with the kidneys, it's going to affect the potassium. Its normal level in the body is 3.5 to 5 milliequivalents per liter. If there is too much potassium in the blood, this is called hyperkalemia, and that would be over 5.5 milliequivalents per liter. Typically this results in no symptoms. Occasionally when severe it results in muscle pain, muscle weakness, or numbness, irritability and anxiety, palpitations and dysrhythmias, irregular heart rhythm, so it can be detected on an electrocardiogram. It may also cause a decrease in blood pressure, and abdominal cramping and diarrhea, and decreased urine output. Hyperventilation may indicate a compensatory response to metabolic acidosis, which is one of the possible causes of hyperkalemia. This case may be also caused if someone is already taking high amount of potassium supplement, or it may be caused when potassium excretion is affected by kidney failure. Common causes also include hypoaldosteronism and rhabdomyolysis. And a number of medications can also cause high blood potassium, including spironolactone, nonsteroidal anti-inflammatory drugs, and angiotensin-converting enzyme inhibitors. The severity is divided into mild, 5.5 to 5.9, moderate, 6 to 6.4, and severe, greater than 6.5 milliequivalents per liter. For the treatment of this case, several agents are used to transiently lower potassium levels. The choice depends on the degree and cause of the hyperkalemia, and other aspects of the person's condition. On the other hand, if there is too little potassium in the blood, this is called hyperkalemia. Mildly low levels do not typically cause symptoms. But with serum potassium concentrations of 2.5 to 3 milliequivalents per liter, may cause muscle weakness, myalgia, tremor, and muscle cramps, decreased intestinal motility and constipation. It increases the risk of an abnormal heart rhythm, which is often too slow, and can cause cardiac arrest. With more severe hyperkalemia, flaccid paralysis and hyporeflexia may result. Causes of hypokalemia include vomiting, diarrhea, and medications like furosemide and steroids. It may be also caused by dialysis, diabetes insipidus, hyperaldosteronism, hypomagnesemia, and not enough intake in the diet. It is classified as severe when levels are less than 2.5 milliequivalents per liter. Low levels may also be suspected based on an electrocardiogram. Treatment including addressing the cause, such as improving the diet, treating diarrhea, or stopping an offending medication. So again the normal potassium level is 3.5 to 5. If it's too high, 6.5, this case is hyperkalemia. And if it's too low, 2.5, this case is hypokalemia, and both cases are life-threatening. So potassium level should be monitored, especially with digitalis, diuretics and intravenous fluids.
Application in medicine. Sodium zirconium cyclosilicate is a highly selective cation exchanger that interrupts potassium in the intestinal tract in exchanger for sodium and hydrogen. We recently reported the results of two phase 3 randomized trials involving more than 1,000 patients that indicate that sodium zirconium cyclosilicate was effective in lowering the serum potassium level in a broad cause section of patients with hyperkalemia. In the total cohort of the combined studies, 45 patients had a baseline serum potassium level of at least 6.0 mmol per liter and received a 10 g dose of CS9.
Hyperkalemia refers to abnormally high levels of potassium in the blood. In normal circumstances, more than 90% of the total body potassium is intracellular. The remaining is in the extracellular fluid and blood plasma. The ratio of intracellular to extracellular potassium is important for generation of action potentials and is essential for normal functions of neurons, skeletal muscles, and cardiac muscles. This is why potassium levels in the blood are strictly regulated within a narrow range between 3.5 and 5 millimoles per liter. As the normal daily dietary intake of potassium varies widely and can be as much as 100 millimoles a day, the body must quickly and precisely react to keep blood potassium levels within the normal limits. This is achieved by two mechanisms: excretion of potassium through the kidneys and intestines, with the kidneys playing a predominant role. Shifting of potassium from the extracellular fluid into the cells by the sodium-potassium pump. The pump is mainly regulated by hormones such as insulin and catecholamines. Hyperkalemia is defined as a serum potassium concentration higher than 5 millimoles per liter. Hyperkalemia may result from decreased excretion, excessive intake, or shift of potassium from inside the cells to extracellular space. Usually a combination of factors is responsible. The most common scenario is a renal insufficiency combined with excessive potassium supplements or administration of certain drugs. Impaired kidney function is most prominent. Excessive intake or extracellular shift is rarely the only cause. Mild hyperkalemia is often without symptoms, although some patients may develop muscle weakness. Slow or chronic increase in potassium levels is less dangerous, as the kidneys eventually adapt by excreting more potassium. Sudden onset and rapid progression of hyperkalemia, on the other hand, can be fatal. Primary cause of mortality is the effect of potassium on cardiac functions. As potassium levels increase in the extracellular space, the magnitude of potassium gradient across the cell membrane is reduced, and so is the absolute value of the resting membrane potential. Membrane voltage becomes less negative, moving closer to the threshold potential, making it easier to initiate an action potential. The effect this has on excitability of myocytes, however, is complex. While initial changes seem to increase myocyte excitability, further rise of potassium has the opposite effect. This is because the value of membrane potential at the onset of an action potential determines the number of voltage-gated sodium channels activated during depolarization. As this value becomes less negative in hyperkalemia, the number of available sodium channels decreases, resulting in a slower influx of sodium and subsequently slower impulse conduction. In experimental models, ECG changes produced by hyperkalemia follow a typical pattern that correlates with serum potassium levels. Peaked T-wave, P-wave widens and flattens, PR interval lengthens, QRS complex widens and eventually blends with T-wave. In practice, however, this pattern is present only in a fraction of hyperkalemia patients and does not always correlate with potassium levels. This makes diagnosis on the basis of ECG alone very difficult. Given the dangerous nature of acute hyperkalemia, it must be suspected in any patient having new bradycardia or conduction block, especially in those with renal problems. Severe hyperkalemia is treated in 3 steps. Calcium infusion is given to rapidly reverse conduction abnormalities. Calcium antagonizes the effect of potassium at the cellular level, stabilizing membrane potential. However, it does not remove potassium and should not be used in the case of digoxin toxicity. Insulin is administered to stimulate the sodium-potassium pump, promoting intracellular shift of potassium. Hemodialysis is performed to remove potassium from the body. Longer-term treatment for hyperkalemia without conduction problems consists of reducing intake and increasing excretion. Thank you for watching. Please feel free to suggest a topic you want us to cover by leaving a comment.
Pros and cons. Pros. There were no serious adverse events or cases of hyperkalemia during the initial 48 hours of treatment with CS9. Cons. Sodium zirconium cyclosilicate is currently in one phase 3 clinical, testing its safety and efficacy. In-suite applied in Ecuador. Kidney failure is usually associated with severe hyperkalemia from the beginning of the damage. Approximately 1 million of Ecuadorians suffer from kidney failure. In conclusion, in patients with severe hyperkalemia, vaseline treatment with a single 10g dose of CS9 resulted in a rapid and significant reduction in the serum potassium level as early as 1 hour after the administration. These findings suggest that CS9 may be a therapeutic option in the urgent treatment of patients with severe hyperkalemia.
Today's topic is hyperkalemia. Hyperkalemia is an elevated level of potassium in the bloodstream. Potassium is a very significant body mineral. It is one of the main blood minerals called electrolytes. The others are sodium and chloride. It carries a tiny electrical potential and is critical to the function of the nerve and muscle cells, including those in the heart. It helps the body regulate the activity of the muscle as well as maintain normal heart electrical rhythm. It also regulates the water balance and acid-base balance in the blood. Potassium is found in a wide range of food, such as fresh fruits and vegetables, tomatoes, sweet potatoes, oranges, broccoli, blackberries, apples, banana, avocados, peas, lima beans, and apricots. Whole grains, nuts, fish such as salmon, sardines, and cod are rich in potassium. The normal blood potassium level is normally 3.6 to 5.0 millimoles per liter. The severity of hyperkalemia is divided into mild, moderate, and severe. Potassium level between 5.5 and 5.9 millimoles per liter reflects mild hyperkalemia. Potassium level between 6 and 6.4 millimoles per liter reflects moderate hyperkalemia. And levels above 6.5 millimoles per liter are severe hyperkalemia. Circumstances that interfere with potassium balance can affect the electrical impulse necessary to sustain heartbeat, causing an abnormal heart rhythm or even sudden death. Causes. The common cause is kidney dysfunction, such as acute kidney failure and chronic kidney disease. This is the major cause of the condition. Extra potassium that the body does not need is removed from the blood by the kidney. When there is a dysfunction in the kidney is unable to remove extra potassium in the right way, and too much of it stays in the blood. Medications such as beta blockers, ACE inhibitors, NSAIDs, angiotensin II receptor blocker. Dehydration, type 1 diabetes, disease of the adrenal gland such as Addison's disease. Rhabdomyolysis, internal bleeding. Symptoms, feeling tired or weak, unusual or irregular heartbeats or palpitations, chest pain, trouble breathing, nausea, muscle pain. Diagnosis and treatment. The diagnosis may involve taking your medical history and carrying out a blood test. The blood test measures the level of potassium in the blood. The blood test is like many other. A small needle is placed into a vein on your arm, and your blood is drawn out into a tube and then sent to the lab to be tested. An electrocardiogram will also be done to check for significant risk of abnormal heart rhythms. Treatment. Treatment may depend upon the underlying cause, the severity, and the overall health status of the patient. Mild hyperkalemia in a healthy individual may be treated without any hospitalization. If the condition is severe, an emergency treatment that includes hospitalization in the intensive care unit under continuous heart rhythm monitoring may be necessary. The goal of treatment is to help the body get rid of excess potassium quickly and stabilize the heart. Hemodialysis is the most rapid method of removing potassium from the body. This is the best treatment option for those with kidney failure. Hemodialysis uses a machine to remove waste from the blood, including excess potassium when the kidneys cannot. Prescription drugs may also be used to treat high potassium levels, such as diuretics, pills that increase kidney potassium excretion in urine. These may include loop diuretics, like furosemide, thiazide diuretics, like chlorthalidone, sodium polystyrene sulfonate, as in chiaxylate. You may be advised to stop or change meds that are contributing to your condition. A low potassium diet per day. Intravenous administration of insulin, which is given with an appropriate amount of glucose. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.